because we knew that we had a group of academics around the world who all work on a similar topic, but who were not necessarily located in the same place, and also coming from various different disciplines. So we're not even necessarily meeting at the same conferences, etc. So we've started this reading group, and of course, now that we're all living in a virtual space, it actually turns out to be very appropriate for our current times. So far, we've had our usual format has been to have a presentation of a paper from a speaker, and then a respondent from the group to that has the pre-read, has done a summary, and yes, as we would see in a kind of conference panel, has a response to the paper. And then open question and answer and discussion of the paper. And we will keep going in that general format for the next sessions that we have throughout the rest of the year. If Rima, if you can also put in the chat just a general reminder to everyone that you're very welcome to sign up. I think we have Philip Ullman from Humboldt, who's giving the presentation in May. And then various people after that. So you're very welcome to sign up to speak or to respond, and that's an ongoing open invitation to the group. However, today we, in light of the vastly different scenario we're finding ourselves in from even a month ago, we wanted to take the opportunity to have more of a conversation between the group about our shifting research priorities and our shifting research practices at the moment, and use this as an opportunity just to have more of a bit more of an open conversation so we can just learn from each other about how we're changing, but also maybe identify some further research questions or research ideas that we all might want to take forward around the effects of COVID on religion and development research. So religion and development research is our organizing topic in this group, and what we're all coming around. And then in light of the current situation, is there something that we would like to focus on or bring together, and where does the interest lie? So for those of you joining for the first time, welcome, but also just to note this is a slightly unusual session that we're hosting, and we'll go back to normal. We'll go back to normal for the next session. I'm very aware that a lot of people probably have a lot of COVID webinars every day, so we don't want to do this too much because we're all going to get a bit overwhelmed by the amount of COVID specific webinars if we're not already. But I hope that you'll find value and see the worth in us doing it this one time for this session. Okay, so our overarching kind of question for the session, what does the COVID-19 pandemic mean for religion and development research? What I'm going to do is basically open the floor. I'd ask you with Zoom, you are able to raise your hand as a participant, and we will hopefully, I mean, we're very interested to hear from as many people as possible, if and how it's changed your research priorities, the research questions that you're thinking about, and you know, any overarching reflections about how you think religion and development research should respond to this. I mean, obviously we're a relatively small area, but there certainly is relevance in this field. So what I'm going to do now is I'm just going to turn over. I mean, I think that we have some stuff to present from the JLI side, but I want to make sure that everyone gets a good opportunity to speak. So if you would raise your hand, and I turn over to anyone that would like to go first and get the conversation started.
I don't mind. Oh, is someone else about to say something?
I'm just thinking,
Emma.
how do we, where's the raising hands? Is it a reaction thing? No, reaction is
Oh,
clap.
yes, the raising hand, it's next to, oh, can you tell me where it is? In fact, sorry.
Do they see reactions?
Oh, sorry, I was just going to say we have to open up the participant chat window. Clicking where it says participants at the bottom of your screen, a window will open up with a list of people, and at the bottom of that there are some participation icons. The first one says raise hand.
Oh, perfect.
Thank you very much. Yes, sorry.
No worries.
So I raise my hand after Emma.
Okay, Emma, go ahead then.
Oh, okay. Yeah, so I hadn't given this a lot of thought until the last few days ago, partly because I've had the virus, but I've also been working on 3 related grant applications to the Arts and Humanities Research Council, looking at local faith actors in peace building in South Sudan, Sri Lanka and the Philippines. So they've gone in, but it sort of struck me at the last minute whether or not we should be writing something into those applications about COVID-19. I discussed it with some of my collaborators, and some, one in particular felt that it was maybe sort of being shoehorned into the application, and perhaps we shouldn't include it. And I did take the decision in the end to include mention of it in one of the applications. I mean, it's too late now with these projects to make it the focus. But I've just put in a link to a report that I came across, because others are obviously already thinking about this with respect to faith and peace building. So it's a link that I've just put in the chat. But it's a very interesting, very short report based on a consultation that was carried out in the first week of April. So it's only just happened, between Peace Direct and Conducive Space for Peace. And they consulted over 400 peace builders from 60 countries. And it's a few pages long only, but it's got some very interesting observations about the way in which COVID-19 could exacerbate inequalities that lead to violent conflict. Also the ways in which it could offer some opportunities for local peace building, drawing attention particularly to the important role that young people can play in terms of their lower vulnerability to the virus, and also the fact that they're so tech savvy as well, and know how to really use social media and online platforms. So I'm just mentioning this at the beginning. I don't really have much more to say about it, but it was I just thought it was very interesting and enabled me to have a hook on this to include in the application I was just submitting. So yeah, that's all I want to say at the moment.
Thanks, Emma. Yeah, it's interesting. We've seen quite a lot about the role of young people and tech potentially, but also the fact that there's this idea that adolescents are not as deeply affected, but then affected in other ways that has perhaps been ignored from isolation, and this generation that are not going to have had potentially been connected to schooling for several months, if not longer, and the longer knock-on effects of that as well. So I think, yeah, this idea of young people, and then especially in faith communities where there are youth groups, etc. What's the link there? That's something that we've seen a bit about, but not really that much. Okay, Severine, please.
Yeah, well, I've been mainly thinking about climate change a lot, and whether COVID-19 will have an impact on the way we deal with climate change. In some ways, I haven't been doing research yet on COVID-19. I think that we are still in the crisis, maybe a bit too soon to evaluate its effects. But one question that I've heard a lot is whether COVID-19 will change our priorities. In Amartya Sen's language, whether they will change what we have, what we value, and especially whether people will rediscover another sense of the sacred in nature and in relationships. So I've heard many stories of people who suddenly rediscover the beauty of a dandelion, the beauty of a tree, the importance of spending time with family. and I wonder whether people's relationship to faith will shift. And in the Catholic circles, we are talking a lot about the impact of having no Eucharist for 6 months. Because Germany has decided that all places of worship will remain closed till the 31st of August. And that is really shifting our understanding of our belonging to a religious institution. It's also shifting our key concepts, key understandings of God, of religion, what it is to be a church. And I think that there's a lot of research to do later on about how the COVID crisis has shifted people's belonging or relationship with a religious institution, and also how it has shifted people's sense of the sacred, that suddenly people start to discover God in their garden, and not so much in attending a church, especially as not all the Easter liturgies were done at home or online. And then something that is emerging is also the role of faith communities as support network. Parishes in the UK have all started to have this support group, solidarity group, and also you have lots of community organizations. A lot has been said already about how neighbors have started. And here in my neighborhood, there's a special neighborhood help. But also churches have been really stepped in, especially in terms of the funerals, that so many people are dying and the loved ones are not able to say goodbye, they're not able to attend the funeral, and even if one is not attached to a religious institution, the process of grieving is an important one, and so how that also has shifted, how faith communities are dealing with that, the fact that so many people have to grieve in a different way. And yeah, I noticed as well that in the Vatican, the Pope has set up a COVID-19 task force, and it started last week. And so, I would say, watch this space, and that relates to how the faith communities are not only speaking on behalf of the poor. And I've read some accounts of 2 priests in South Africa who started to say, well, poor people in slums, it's all well for them to be done fine, but then where in the informal economy, where were they going to find their living from? And so churches are globally now reacting and speaking on behalf of the most vulnerable, and I wouldn't say shifting policy, but at least having a voice in the policy process and how to manage these competing demands. Yes, we need to isolate people because they're contagious, but for many people, it's a matter of choice between, are you dying of hunger or are you risking dying of the virus? And I think churches worldwide are raising that up, these hard choices that poor people have to make. And I think that'd be an interesting research topic later on. I think that the crisis is still evolving and we are responding. So maybe it's a bit too soon to research the response of the church. But I think there's a lot to be done already or later on about the kind of role of churches in supporting vulnerable people and also being involved in the policy process in the COVID response. So I'll stop here.
Yeah, thank you very much, Severine, and so many points to pick up there. I mean, I think that we know from all our collective research and that of others over the years that it's the faith communities that step in when there are these social protection gaps that aren't otherwise covered within systems. And I think that something that we've seen in various conversations, when we first started conversations around the kind of religion and COVID thing, it was just, we need guidance for adapting rituals and guidance for adapting gatherings, etc. Whereas now there's been this greater shift towards, well, we've got some guidance materials from that are relevant in the UK, that are relevant in Germany, that are relevant in North America. Yet those are not relevant in other countries around the world. And as you're saying, some of these contexts where there's not the access to running water for regular hand washing connected to a religious building, there's not the, there's very close contact within certain urban environments, and that's where the virus is going to spread massively. And so I think that we had, certainly in JLI, we've seen, you know, a lot of people have sent us guidance documents from various denominations, from various religious councils, etc. But there's now perhaps this gap of what is going to be of interest and relevance in terms of guidance on these adaptations in contexts where there's just a completely different scenario that doesn't make, you know, everyone joining a Zoom platform the most relevant guidance there. Yeah. So I see Bram's hand. Bram, over to you.
Yeah, I just wanted to talk about sort of what we're doing with. It's more, in a sense, the practice, and you know, with the Salvation Army, we're in about 130 countries, and we've had to shift our ongoing, well, a lot of our community development projects in various sectors, from health to income generation, have either stopped or moved, you know, gone to a go slow mode. And what's replaced that is okay, what can the Salvation Army in countries do related to the COVID virus? And I think a research topic would be very interesting. How flexible are we in terms of moving and shifting priorities based on an emerging, you know, pandemic like this? And you know, we're having to deal with questions of you know, in the project sectors, what do we do with staff related to, in these days where they're already working on a shoestring, and we want the programs to, when things are better, to be able to get back to their normal. What does that mean? How do we do that? How do we prioritize that? And it's difficult for countries to, you know, to say, well, if I don't pay my staff, what happens? You know, they lose their livelihoods, they lose their abilities to function. So we're having to negotiate questions of priorities and how to do that effectively. So some real practical sort of project management questions are emerging out of all of that. And then also, yeah, the role of the church. We are the church in the community, so how do we do that well? And I think we are getting a lot of response, a lot of asks for some additional resources to be able to make that happen at the community level, where, again, the Salvation Army is working, you know, very, doesn't have a lot of resources in country in many places, but with just a little support, then they're able to move and continue to be the church out in the community. And then we are also talking about what can be done without additional resources, but just, you have the network, you have the connections, you have the relationships, and in many cases, you know, they've really stepped up on that. So I think the whole point of, like we've in the past talked about, what is we've talked about, the church needs to be there in these times of crisis, in HIV/AIDS and other areas. So how do we document those and write up those as case studies for us to share with each other as well, you know, who are involved in this work, but also to tell the larger community, to the development community, the governments and everything, that the church or the religious organizations, religion-inspired organizations, are part of these big complex issues that are coming up, and we can make an impact, that don't forget about that side of things. So I think those are some of the things that we're encountering and we're thinking about, and it's important to document so that we can, again, get the story out and share the story and learn from each other. Because I mean, I know what we're doing in our organization, but I haven't gotten a lot in terms of what other other faith communities, and maybe I'm just not looking in the right places, but there is plenty of opportunity to share best practices, and that we could start doing now, because I agree with the previous speaker. Some of the research related to the impact of all that we're doing will be down the line a bit, but they are like, how do we do the best way we can now? That's all I have to say.
Thanks, Bram. Yeah, I think I heard someone said that this is going to be the most well-researched pandemic that's ever been, because we're all like simultaneously doing our research, and we'll be doing it for many years to come. And there's one thing that you said about networks, relationships, connections. I think something that we've seen is a lot of the usual way of working and the usual information that we hear from research about faith communities and development is the idea that it's the networks, the volunteer networks, the access to places that you wouldn't otherwise have access, that means that faith communities have this added value, even though we might not want to speak in those terms of added value. But the thing that's really different this time around is the usual things that we would advise around, participatory group meetings between development and faith actors to get everyone understanding each other's priorities and working together, etc., are just not part of this context because of the need for physical distancing. So a lot of the things that, dialogue and the particular role of dialogue that comes out all the time in working with faith communities in peace and development work, etc., it's not constituted physically in quite the same way, and that's where it's going to be interesting to see and hear about all the adaptations that people will be using to still work with the networks that exist and will continue to exist, but need to operate a bit differently. Okay, thanks, Bram. I see Jonathan's hands. Jonathan was going to be our speaker for some time, but we've changed over. We hope to hear from you about your broader research in the future, Jonathan. But please. Oh,
I was really happy to have the excuse not to have to present. So I don't want to say I'm grateful to COVID-19, but I just say a quick thing. It's just a couple of reflections. I mean, the come from the perspective of being interested in studying humanitarian crises and the response of local communities, and particularly with religious dimensions. I think there's something very unique about how this is definitely a humanitarian crisis, but it also has uniquely global aspects that most humanitarian crises don't. Often they may affect, an earthquake may affect 3 or 4 countries, or a tsunami, but this is actually affecting, to some extent, everyone in different ways. So it seems like it's a valuable opportunity for some type of broad comparative study, although it seems very difficult to do something like that in the middle of a crisis, because people are responding to it and focus a lot more on probably what would be useful action research. How can we respond better, rather than a sort of reflective research where we can develop really good reflective designs and have great conclusions. But a couple of things that stick out to me: if there was a way if we could collect data and then analyze it later, it's a really good opportunity to study, I think, the global north as well as the global south in a more comparative way, because often our research ends up being, how does this XYZ developing country respond to this crisis, when this is actually an opportunity to study how well does the global north countries respond to humanitarian crises in terms of preparedness, in terms of community assets, in terms of responses there. So that would be really fascinating. And it's similar to me, I guess, in how the Sustainable Development Goals are supposed to apply to all countries, not just to global south countries. So this is a kind of a test case of what does a humanitarian response look like in different countries. And on that note, then I think a second thing would be looking at then how these responses take shape, particularly focusing on inequality and how some people are affected more than others by this unique type of crisis, and how that intersects with people's identities, particularly I think for us in terms of religious and ethnic and cultural identities, how those intersect with how people are disadvantaged and struggle in their responses, and then how local institutions and actors are involved in that response, particularly religious ones, I think, from our perspective. So which makes you think about the idea of the concept of localization, which is a big thing that I've been working on. What does localization look like? For example, I've been involved in some of the humanitarian response in London by local councils. Particularly, I'm doing some work with Lambeth Council in London. What does it mean to have a localized response? How does the needs for food for someone who's stuck indoors, suddenly who's not told not to leave the house, but everything they do involves leaving the house, getting food, going to the bank. How do they then manage that? What kind of response is created, and to what extent is that actually adapted to people's needs rather than just being a sort of, kind of a general sort of response? So what does localization look like? And being able to compare different contexts, so London and and Indonesia and Lebanon, just to that would be really fascinating. So that's all for now. Thanks.
Yeah, I love that point about the universalism of the SDGs and how we should be looking across different contexts, because we often, we've often heard this idea of some of the materials that are developed for use in sub-Saharan Africa are just as relevant, say, on faith and gender-based violence or something to countries in Europe and elsewhere. And I think this is a good opportunity. So now I see Hannah. Hannah's hand. Over to you, Hannah.
Hi, I'm new. Thanks for having me. My name is Hannah. I'm in Thailand, and I'm with a Christian humanitarian aid organization that works to train rural healthcare workers for the most remote parts of Myanmar. And so my organization has training sites both in Thailand. And when this all started, as a member, there were some early cases in Southeast Asia. But now the cases are slowing here, or at least they haven't progressed as quickly as they have in the Western parts of the world. So more than a month ago, my organization had to decide where people were going to stay for the foreseeable future. Mostly we cross back and forth. We bring students to different training sites in Thailand and then in the part of Myanmar proper, as well as in the ethnic minority areas. And so in early March, I believe, the husband-wife team who lead our organization decided to split up. And one of the doctors stayed in Myanmar and one came to Thailand. And so we're planning to just kind of stay where we're at. But for those of us on the ground, this is an unprecedented thing that has happened. Our students have either had to not come for our new school year, they've had to stay where they are, and we're training medical students. So it's a very interesting opportunity for them. But as of today, I just heard that the Myanmar government is not allowing groups larger than 10 people to meet, which includes our training program. So our students were working in the clinic, and now they're not allowed to work in the clinic, except I believe in our acute fever and cough clinic, which is set up just for COVID. So anyway, what I just want to talk about for a minute is, it seems like this part of the world, which Thailand is one of the most developed countries in Southeast Asia, but Myanmar is definitely part of what we call the global south, or the third world. And while they have not identified a lot of cases yet, the development repercussions of the virus have already been catastrophic. And we are seeing, we're predicting that the development progress that we've seen recently is really going to be reversed there. And I'm talking about everything from the civil war that's been going on in Myanmar for the last 7 decades is already, the military is becoming more aggressive towards the ethnic minorities just within the past few weeks in both sides of the country, the western side as well as the eastern side where we work. A lot of the people there live really close to the margins, meaning they've been told by their leaders that they need to collect rice because the borders are closed. And so they need to have enough rice to live for 3 months, but most of them can't afford that. On top of that, we had a plague of bamboo rats come through last year. And so they're already closer to the margin than they would have been before the virus started. Then there's other things going on, like some of the clinics similar to ours in the really, really rural areas of kind of the jungle mountainous part of Myanmar have adopted the policy for COVID-19 that if you have a fever and a cough and shortness of breath, you should not visit a medical center because you just risk infecting other people there, and we really have no way to help you. We don't have any ventilators in this part of the country. Some of the clinics don't even have oxygen tanks. And so the best policy that some organizations have come with, even come up with, even the humanitarian aid organizations, are that the elderly people should live apart from their family for the next 3 months. And those that are sick or with symptoms should also live somewhere else, like in a small house in the rice field or something, away from their family, and no one should visit them. Now, we understand that realistically, no community is going to abandon their sick or their elderly. So we've started training some village healthcare workers, whether or not they have medical experience, whoever we can find basically, to wear personal protective gear and bring food to these people. So I guess this is just an illustration of, in some parts of the world already, whether or not we're dealing with the virus in a big way yet, we're having to deal with something that we're not prepared for socially. In some ways, we were more prepared than the West, in my opinion. In Thailand, everyone already wears masks when they have any kind of respiratory illness. So I think everyone has different opinions about that, but the growth of the virus that has slowed here, I think, is due to the fact that there's hot weather, we all wear masks, more of society takes place outside, things like that. So we never may get to the point of the caseload that is happening in the West, but there are arguably worse or terrible things happening because of the virus that are indirectly related. So I just wanted to share that from what I'm working on here.
Thanks, Hannah. Yes, really interesting. And I think the thing that we always have to think about is, any time during a humanitarian response, it's overlapping vulnerabilities. And so it's the fact as well that we have situations such as, East Africa, we were hearing all about locusts until the pandemic started hitting the news cycle. And we haven't heard so much about that, but that's still an issue, etc. And then absolutely, I think the rise or the potential for violence is something that's coming across as well. We've heard a lot about the rise of domestic violence, for example, but also after periods of lockdown, the unease and tensions that can happen. We're already seeing reports, say, for example, in India, of discrimination towards certain religious minorities, but that's also the case in other countries as well, and basically using the context of the lockdown to continue forms of discrimination and violence that have already existed and perhaps are now going to be exacerbated. So yeah, it's really interesting. Thank you so much, Hannah. I see Richard's hand, so please, Richard. Yes, you're unmuted now, Richard. I think we should be able to hear you. Richard, we can't hear you, I'm afraid. You might have to add your microphone in another way. In the meantime, I'll pass over to anyone else. I know I can see people on this call that have definitely had to change their research recently. So I don't know if there's anyone that else would want to speak up, but I don't want to put you in the hot spot too much.
I could very quickly mention my change. So I was doing I'm in the second year of my PhD, and I was looking at interreligious cooperation in fragile contexts, or contexts with pockets of fragility. And I was meant to be doing my fieldwork in Ethiopia in collaboration with World Vision. And the day I was meant to fly to start my fieldwork, I got a call saying that they'd initiated a total travel ban, and I couldn't go. So I've started to readjust my project to look at faith-based or religious responses to COVID-19. So everything's still a little fuzzy and hazy at the moment as I try and kind of focus down on what I'm actually going to be looking at, given the kind of constraints that I'll be working under in terms of field work and things. And one of the areas that I'm still interested in is interreligious cooperation. So building on what we were just talking about with interreligious tensions growing in some contexts resulting from COVID-19, I'm interested potentially in who are building bridges and the role that interreligious cooperation and social cohesion are playing in kind of international faith-based organisations' responses to COVID-19, as well as the role that religious networks are playing now in a world where we can't travel, but organisations are still looking to kind of strengthen their localization efforts. So yeah, things are still a bit hazy for me, but it's definitely affected my research.
Thanks, Ellen. Yeah, that's quite a direct response. I don't know, Richard, if you're back on the line, if you want to try again. Oh, I don't think he's even on the line. He must have had to log off and log back on again. Okay, so is there anyone else who would like to talk about the impact on their research or research ideas before we go to the next section?
Olivia, this is Michelle. I can chime in if we have a moment.
Yeah, please go ahead.
I've been relatively quiet because most of my projects were in a transitional state when the virus hit and are therefore on hold and facing all kinds of uncertainty, which are interesting dynamics for us in and of themselves. But I wanted to comment more specifically following up on Ellen's research interests. Just to say that, yes, in addition to what Ellen is looking at in terms of interfaith collaboration, social cohesion in the context of COVID-19, there's quite a specific question of both research and practice that's come up with one of my partners, which is for organizations that are focused entirely on interfaith collaboration and cohesion, and who have always done that work face-to-face. Or, you know, safe to say 80 or 90% of that work and the heart of the work has been done face-to-face. How are they adapting and how can they effectively adapt? I mean, certainly there's a shift to talking together and working together across faith communities online, but it's still an open question, you know, how well that will work and what needs will be unmet, and therefore what is the trajectory of these efforts going forward if people continue to be unable to meet. So yeah, just adding in another specific angle on Ellen's research questions. Thanks.
Thanks, Michelle. Yeah, I think it's a really significant remaining question. And again, as we say, we're going to see more about this in the coming months about how the adaptations are happening. I mean, I do wonder as well if there's anyone who's regularly working with in their research context with a certain in a certain country with a certain faith community, if there was any information that had been shared with you about those contexts and what's happening, what you're hearing from research participants already. If there's anyone that has any information like that they're willing to share, I think that would be interesting too. Okay, so I'm going to go to maybe the next section that we have on the agenda, but Severine, please, yes, go ahead.
Yeah, about current examples, a lot of these faith organizations are already working together. I'm thinking about the Kafir and Islamic Relief. They already have a long tradition of responding together to humanitarian responses. So I think there's probably a lot going on, and if research is to be done in that area, I think it would be quite easy, I think, to go to these collaborating institutions already and see what they're doing on the ground. Yeah, just that.
Yeah, exactly. And so maybe we'll just get on. I think that maybe leads well into the next section, which is just to talk about the practicalities of research in this context, but also any practical resources and adaptations that you have seen or used for research and teaching at this time. So I know that we're getting into a little bit of this debate about how do you do research in this time, and there's been I've seen various webinars pop up from In Vivo and others about how to do ethnographic field work online and things like that. So there's that kind of information. And then adaptations to teaching, specifically teaching about religion and development. But first, what I'm just going to do is take the opportunity to share with you this online resource that we've been putting together. Hopefully you can see that I've shared my screen now. And so this is we're updating it almost every day at the moment. Well, actually, yes, we are updating it every day, not almost. And there's a lot of information on here, but it's a lot of information that's only been partially organized at this stage. We're kind of decided to put this up with Catherine Marshall at the Berkeley Center and with various others pitching in to help. And the whole idea is that we just wanted to get something online where we could start to submit and organize and gather resources that we're seeing coming up. And so we've got a bit of a quite extensive list of resources now. A lot of it is news reports, which are worthy in themselves, for some type of content analysis in the future potentially, but also a lot of the guidance documents that are coming out from, as we've discussed, the faith-based organizations of this world, the religious councils of this world, etc., who were quite quick to produce materials, make statements and different guidance documents. Also information from previous experience, so previous experience of working with faith communities on water, sanitation and hygiene, for example. The previous experience in Ebola obviously is coming out in conversations quite significantly as a relevant learning opportunity, but also a quite different disease to some extent, and there's very interesting ways in which the learning from Ebola is not relevant, or in fact particularly unhelpful for this response, but also learning from faith communities with HIV, which is a largely and well-researched area in comparison to some others. And gender-based violence, etc. So things that we know, might be on the rise, as we talked about. The reason why I wanted to bring this up is, well, firstly, just the, if you're seeing information that's of interest, we'd love for you to share it so we can post it on this resource repository and just kind of continue having this as a central location of information. Obviously, we're not claiming that this is comprehensive. It would just be completely impossible to really pick up all the information that's being reported about religion and COVID every day. But something that is interesting that we've noticed is that, with Ebola, I'll go back to that example, it took quite a while for the humanitarian community to have that light bulb moment of realizing that working with religious and community leaders was going to be a real game changer in the response. Whereas this seems to be happening a little bit sooner, but not least because a lot of the news reports have been around the negative role of religion. So the fact that a lot of the initial outbreaks were happening within religious communities, the fact that there's now this religiously based discrimination, the role of funerals, as Severine has already brought up, etc. So we're seeing a lot more reporting, and also the role of some religious leaders going against instructions to isolate and stop physical gatherings, etc. So we're already seeing a lot of interesting trends and information coming up. So the second reason why I wanted to bring it up, the first reason, I'll put an email link in the chat, and that's the email link where you can send any information if you think it's interesting for us to include. But the second reason why I wanted to bring it up was that we have this resource repository. It's very beginning idea of something, you know, there's so much more that can be done with it, and you're already bringing up some research ideas I see on the chat, but basically I feel and we all feel that there might be some way that we can get the ball rolling even already to start thinking about research questions, the way that we're using these different resources coming through, you know, the potential to form some kind of groups and understand how we can, you know, work together on research ideas. So I wanted to kind of bring that up as the next area of discussion and conversation. Okay, so yeah, that's enough for me. I've probably talked too much. I didn't want to talk too much more. So I want to just pass it back over to the group for, again, any points that you want to bring up around the role of, you know, the changes to your research work, etc., that might have been happening. But then anything that you would, you know, any responses to the idea of bringing together research ideas, research projects, and the possibilities around that, and the ideas that seem to be of interest. Okay, so again, I'll just stop sharing my screen. Please raise your hand to speak. Oh, sorry, I'm just seeing in the chat that Richard is back online. Richard, sorry we missed you before. I think you're back online. If you would unmute.
Okay, can you hear me now?
Yes, we can.
Okay. About 4 years ago, I organized a session at the Society for International Development chapter in DC on the unique role of faith-based organizations in international development. In fact, Catherine Marshall of the Berkeley Center was a participant on the panel. One of the conclusions that came out of that was that conversation was that faith-based organizations have a unique moral authority in pushing for social and individual change. And since dealing with this, with the pandemic, is all about social behavioral change, short run, for example, hoarding, and in a long run in terms of how we interact socially. Has anyone done any work on the role, or has anyone tried to see what role faith-based organizations can have on dealing or encouraging the type of change that's needed in society, given their unique position? For example, for me, the silence from faith-based leaders on the hoarding that's going on locally has been deafening to me. No one is stepping forward to try to put an end to that. That's one question. The other I want to make is a simple observation. Here in the United States, 1 in every 4 Americans over the age of 70 is going to have his license yanked for medical reasons. And in the suburbs where there's no mass transit, it's going to make it very difficult for them to get around, including being able to participate in church services, religious services, and religious communities. And perhaps one of the good news, or one of the fallouts from this pandemic, is the increase or the activities that the churches are taking now to do more remote interaction with their congregations. And I'm curious as to whether or not anyone has looked at that to see how that could influence our ability to serve the elderly and other mobility limited populations in the future. That's it.
Thank you very much, Richard. I'm glad we could hear from you. Sorry about those, that we couldn't hear you before. Okay, so the question around social and behaviour change, I think that that's something that, you know, has been worked on in various different ways in the religion and development research field. I know that, you know, we've got a project with UNICEF at the moment, which is entirely about social and behaviour change with faith communities from the UNICEF perspective. So there are bits of, you know, information, but it's also an incredibly dense field from the social and behaviour change side, with its own massive discipline and areas of interest in itself, in which the role of faith communities have been recognised, but perhaps not thoroughly researched in itself over the years as well. And so I think a lot of the guidance material that's coming out has been specifically encouraging leadership of various forms within faith communities to speak up on topics related to the pandemic. So I know that we've got this there's a campaign with Religions for Peace and UNICEF on multi-religious faith in action for COVID response, and the guidance material that's going to be launched soon, hopefully, for that is very much about the ways in which faith communities, religious leaders can use accurate information, counter false information, you know, the infodemic phenomenon, work against discrimination and stigma that might be happening around this. So I think there's a growing body of evidence and realization for the need for that. But just again, I want to pass back to the group with the question around interest in research questions. I see that I haven't been able to keep up on the chat completely, but perhaps Jonathan or Michelle, I see that you've been discussing something and any other ideas that might be coming up.
Olivia, this is Michelle. Just to say that I was chatting with Jonathan to affirm his idea about the value of collecting parallel data streams across many contexts, including the global north, even if they can't be analyzed until later, and, you know, thinking a bit about what it might look like to organize ourselves to do that. But I don't think, well, clearly Jonathan's thought about it more than I have, but as far as I know, there's no specific research questions attached to that yet. It's more an idea about a mechanism for moving coordinated research forward. Jonathan, did you have any thoughts on research questions?
Well, this is Jonathan. I was afraid you'd ask that. Yeah. So yes, I still kind of forming, but I think it's sort of be around this idea of local responses. So what do those look like in different national and as much granularity as possible, you know, regional and community contexts. And that could be defined either as geographical, or it could also be defined as sort of institutions. You know, what does the response of one faith-based organization that has a global reach look like different in different countries, because they're able to respond to the same crisis in different ways in different countries. So it's a really good way to study, possibly to look at something like localized responses, and what do those responses look like in terms of local religious and cultural values shaping those responses. So that's my initial thoughts, but I need to think more.
Thanks, Jonathan. Yeah, so the granularity is key. I think what we've seen at the moment is quite global trends. I know that with, again, in the context of the resource repository and with Catherine at Berkeley, we're having these webinars every so often where we're here, and there was one just before this call, hence why Catherine isn't on, and various others, where we were hearing from Liberia, South Africa and Ghana, a little bit more about the Christian health associations, about Catholic-run hospitals and health facilities, and other examples like that. I have an awareness that in the first month of the conversations that at least I've been involved in with people on the role of religions in COVID response, we've been talking quite globally and quite generally, and I think that as these conversations go on, there's an understanding that it needs to get more and more specific, and that hasn't quite happened yet as well. Okay, so, well, thank you very much, everyone. I don't see any other raised hands, so please, if you have any, raise your hand now, because we're getting to the top of the hour. If you want to add anything finally. I mean, I think we are seeing overall that as we've correctly identified, that this is just the beginning in many ways. So to some extent, we don't need to rush to too many conclusions about what we want to do. I want to make sure though that we can continue to have a conversation, and please do reach out to us if you would like to be more involved in any way in any of the resource repository pieces that we're doing or anything else. Just, we're happy at JLI to serve as a connecting point for any type of research collaborations that you might want to bring together. If we can help connect you to other people as well, etc., please let us know, and we can hopefully continue to see what research might come up in this area of religion development and COVID. Okay, otherwise, I think that's all for now. I would just remind everyone, so our next session, actually, Rima, do you have the date to hand? I now don't have the date to hand. I think we said, oh, the 14th of sorry, I found it now. The 14th of May is the next session. We have Philip Ullman from Humboldt University speaking about his research on African-initiated Christianity and sustainable development. We don't have a respondent yet, in fact, so please, if you're interested in acting as a respondent, please sign up, and I'll just put the link in the chat now. And we have various other people signed up. So in June, we'll be hearing from Andrea on faith-based organizations in post-earthquake Haiti. In July, from Willis on his work around youth experiences in human trafficking with the Anglican Development Services of Kenya. From Diana in August, I think she hasn't put her paper title, but it's about refugee response and faith-based organizations. From Holly in September on religiously inspired charitable organizations in China. And from Cecilia Lynch in October on her new book, Wrestling with God, Ethical Precarity in Christianity and International Relations. And then I know we've also, Sally Smith would like to speak in November on her work, her PhD research. So we're actually almost at the end of the year. So if you would still like to speak, please sign up, because we're soon to be fully booked. Okay. That's all from me. Thank you very much, everyone. It's great to see you. Hope you and your families stay safe and well. Thanks, everyone.